wanted today, and I have a little break, and I wanted to talk a little bit about this whole epidemic with the GLP1s, the Ozempics, and all that good stuff, and see if I can break it down into 3 different phases for you, right? Because there's the anesthesia perspective when it comes to these drugs, and then there's the functional natural medicine perspective, and then there's the spiritual perspective, okay? So anesthesia perspective and the dangers of it is how it delays and slows down gastric emptying, and this is a big deal, right? And so we have people a lot of times tell the providers will tell you, don't take those drugs for at least a week before your procedure starts. I tend to go about 2 weeks to be on the safe side, because I have seen people still have stomach contents in there after a week. And the reason that's important is aspiration. And what is aspiration, and why is that such a big deal for us with anesthesia? It is a big deal when we're taking care of you and your life is in our hands, okay? Because with aspiration, it's not just the gastric contents coming up. They can go into your lungs. All that acidity in your lungs can cause severe lung damage. If you're not protected with your airway, where we have a breathing tube in, there can be a lot of serious issues if we have to emergently then do an intubation on you. And so when your provider tells you to stop the drug a week or 2 weeks out, do your best to follow through. Follow through on the specific anesthesiologist recommendations. Because if you're at a big hospital, that's a different case. If anything happens, there's a whole team that can come and help you. If you're at just a surgery center, they have to call 911. They might not have enough help. They might not have enough emergency equipment. So do your best to adhere to that and understand that. Now, from my whole functional natural medicine perspective, is the side effects with the thyroid cancer, pancreatitis, and all the other GI issues that I see over there, as well as in anesthesia when I'm doing GI procedures. There is a whole slew of side effects. And so starting to learn how to identify when this might be a good fit for you or not be a good fit for you is something I do in my clinic, talking to you, doing our bioresonance scans to make sure what's your thyroid like, what's your pancreas like, what's your body like, what's your lymphatic system like. All of those things are very important. Okay, now on a spiritual perspective, people can use this as a divisive way, where there's those that they want to try it, they've tried different things, and it's not working. The major issue with this is if you're using this as a shortcut to lose weight, and you're not taking it as an advantage to give you time to rev up all the good habits to actually have to lose weight and keep it off, there's going to be an issue. There will always be something that will come back to bite you in the butt if you don't use it appropriately. And there's the other side where it's like, oh, look at, like, you're cheating, you're doing Ozempic, oh my God. Listen, in life, honestly, people are trying the best that they can with what they've been given. And sometimes we choose a route that we're going to learn a lesson from. It is not in any of us's lane to be judging people that way, okay? And if you are, and I know it happens, it's natural. If you are, take some steps back and take a look at your life and see what ways you might be actually taking shortcuts with people, with relationships, with workouts, not living up to what your own potential is, and how you've been settling is the same thing. It's just now we look at some of these other things and we can see it on people, and so we want to label them. And do your best not to do that, because that also has its implications. Okay, so that's my take. I need to run back in there because they're like, where's Dr. O? Y'all have a beautiful, blessed Monday. One love. Ashe.